you see, as an investigator, now maybe you arrive there, you find there are a lot of things that are not going well. Then you start complaining that maybe here we are losing money, here we're losing money. Then somebody will ask you, are you an external investigator or internal?
Our guest for this episode, Mr. Stanley Kiptanui, CPP, PSP, PCI, CHPA, is the Africa Security Manager at the AIDS Healthcare Foundation.
I learned when I put fire extinguishers at the emergency room. Then my team told me, you have to put a box and make sure it's sealed. I said, no, but the safety requirement is that it's not sealed. Then they told me the mental patients will just pick this one and they use it as a missile to attack the healthcare workers.
In this episode of the Crimeshield podcast, we're looking at healthcare security. We're looking into diversity, equity, and inclusivity in security.
You'll go to an organization and you'll find the CEO is a man, head of organization, head of departments, from operations manager, procurement, finance, marketing. It's only marketing you'll find maybe there's a lady.
Yeah. I'm sure many of you out there are wondering, when you're going to any healthcare facility, any hospital, and you're giving them all this information, what happens?
What we're doing is more.
This episode has been recorded at Wojo Shared Office Spaces, located at Mercure 9th and 10th floor. We'll be sure to put the link in the description so that you can experience what elegance is in Wojo Shared Office Spaces. As always, keep it Crimeshield. When we talk about security in general, it's in very many things. And, Kala and my friend Simon, there are many things that come to mind. Ukiangalia mambo ya healthcare, there are things that usually people want to understand what goes on. But in this topic, nataka tuiangalie in a way that the common consumer, the common mwananchi can basically understand. Tuanzie hapo kwa general security. When you're looking at the current state of affairs, Stanley, what is your take unaonaje security-wise?
Yeah, generally, if you look at the current situation in Kenya, we are trying to regulate the private security, but it's not so coming out so well because the areas we would need to focus more is on not only on the guards, but we need to focus on the entire security system, private security system.
Okay.
Yeah, from policies, legislation. It has to be very inclusive. So to hakikisha everybody ako pale, security managers working for organizations should be there, but not so much on the security guard alone. Yes.
Naongea mambo ya guard force numbers. Unaona, yes. It was a very huge thing.
Yes.
You know the problem with regulating the guards alone is you leave the other stakeholders in the industry. Because you're talking about operation managers, you're talking about security coordinators, regional supervisors, regional managers, all the way to the executive level, which is the CEOs. So if we say we are regulating the industry, then we must go up. And then again, also in terms of services, in terms of products and all that. So that's what Stan is trying to say. Yeah. It's not all that conclusive.
And true, I totally agree, because there are many sectors, in my opinion, that you'll find they're not regulated. And remember, we were talking earlier, Stanley, about the sports infrastructure and what is required to be done. Those are items that, according to me, I feel we really need to look at it in terms of security. And Major, you're talking about transition. In our discussion, you mentioned something. Probably you can just mention so that we can talk about it again.
We always say with Stanley, you are either retired or you are tired.
You're either retired
or you are tired. So it's either of the two. But maybe I just want to ask Stanley, maybe why he left the law enforcement, the National Police Service.
Sure. I joined the National Police Service. That time it was called the Kenya Police Service, the Kenya Police Force.
Force.
In around 2000, after leaving the University of Nairobi, after my undergraduate, then I was posted here at Central Police Station, just next to the university I was working. I was a student.
And ulikuwa unatembea tu ukienda kazi.
So ulikuwa student na bado ulikuwa polisi?
No, nilitoka kama student nikaingia police.
Oh,
and I was among the first graduates among the few that joined the police force. So mtu akishikwa, lecturer akishikwa, ongea na Stanley. Huyo akishikwa, tuko na student wetu. So I was there for around 6 years. Then I got the urge to change and at least join the private security world. But what I was fearing more is because I was an investigator, I used to fear physical security work. Like now going to look after the guards, maybe look after entries, access control. I needed a job that maybe I would be an investigator again.
So you are more inclined to the investigation aspect of security?
That time now.
Yes.
I used
At
to
that time, yes.
I used to know to understand more about physical security. In fact, I got my first job in Kenya Power, and I was posted to the city center there. Then I declined because I said, I'll be running only this one building when I'm a security person, armed and working within the town. But later on now, I got an opportunity at the Ethics and Anti-Corruption Commission. At the time it was called KACC, and Justice Ringera as an investigator. And I was very excited. And when I joined there, I thought of going there as a secondman. But no, they said, you have to choose either to remain in the police force or uaje mambo ya police ukuwe sasa full-time investigator.
So huwezi multitask, huwezi kuwa uko mguu moja kwa EACC
na mguu moja iko kwa police.
Hakuna kitu kama hiyo.
So ilibidi tukarudisha bunduki, tukarudisha certificate of appointment and started a new chapter as investigators with the Anti-Corruption Commission. So I was there for like 6 years.
Wow.
Again, almost all this, it was 6 years. Then I now decided to leave for private sector now fully. And like now, I went again to the Kenya Power, but now this time at Ketraco as a security supervisor, just here in the neighborhood. And I was not there for 4 months. I got a job in the bank again.
Wow.
As a manager investigations. And I liked the bank job again because it had partial investigation and then security.
Physical
management.
security.
Yeah, physical security.
And maybe now, before we go deep into in that bit of transition, maybe now to you, Kingsley. We were discussing about the transition journey. And how it is not that straightforward. And Stanley is trying to bring that out. So maybe also know for you, how has it been, transitioning from the military to forming, a security company? How has the process been for you?
Transition for me has been, I always call it a journey of grace. Because wakati mimi nilikuwa natoka, unaona Stanley ako na lucky number 6, anachapa 6 hapa, alafu tena anachapa 6 ingine huko.
Yes.
Yangu, when I started off, I had a dream of just being able to manage security independent of, how the norms are looked into.
Yes.
Like breaking the status quo. That was my ultimate goal. Like trying to break out from, what people see as the normal. And my idea basically was to, learn from the best. And the best for me at that particular time was in the forces. Yes. Now, getting out, mi nilifikiri it's a bed of roses. Hakuna rahisi huku nje. It was a journey where you have to really network. You really need to know your craft. You really need to cross-train at some point in order to, be relevant in the security space. So just the same way Stanley is mentioning, it's a personal decision. Hauhitaji mtu akuje tena kuambie sasa wewe toka. You just feel it, And that's why, when we are talking about it, you bring in, ideas in terms of understanding different environments. Kama Stanley amekuwa kwa bank, amekuwa EACC,
Kwa
amekuwa Ketraco, you know. That's a wide range of experience. So that even for me fitting in his shoes and even in your shoes itakuwa ni vigumu, but there's always room to learn. So for me it's been a journey yenye imekuwa looking at security in a way that is more of applicability rather than just from the book. I don't know about you.
What I normally say in this journey of transition is how you position yourself, like you've said. Because I don't want to be a job seeker. That's not the goal. I want to position myself as a global security leader. That I want to make Kala not a name but a product.
A brand.
A brand. I want to understand the craft.
Yeah.
And maybe not Stanley. There are people who want to transition, and there's always this fear. Nitatoka niteseke.
Kwanza hiyo utaambiwa sana. Sasa walikuambia wakati ulikuwa unatoka.
Yes.
Ati uko nje utaumia.
So what can you tell now those who want transition ambao wako na hiyo fear na wanaona hapa mbele iko shida? What can you tell them?
Yeah, I recall when we were leaving, we were very few leaving the police service. Many of our colleagues feared life outside. And mostly what they feared was being fired on your first job. And it actually happened to some of our friends who left, and then you were fired the first day, the first no confirmation, maybe because of a shock. But I've been out here now for almost 16, 17 years. And I want to tell our colleagues who want to transition that if you position yourself well, life out here, you don't need to worry about having challenges outside. At least if they can take certification, improve their knowledge, network very well. And then another culture that is required here so much is on the culture of integrity.
Very important.
I think EACC trained me a lot on integrity and ethics, which has helped me to survive out here. But not necessarily working at EACC, but any security professional should have very high integrity and should not be compromised in the work. And whatever you are doing should be trusted. That's where you can get budgets from the executive. They can support your program because they see whatever you are doing is genuine and honest for the organization.
So the name speaks for you once you do the right thing.
Yes.
You get referral from one company to another and so on and so forth.
Sure.
Challenges.
Yes.
Mimi nataka tuongelee hiyo challenges.
Yes.
I want to know from you, Kala, what are the challenges that you faced in terms of now being in the corporate?
Number one was now the issue of transforming this military major to a security manager. And now, I was dealing with national security, and now you're dealing with profit margins, you're dealing with asset protection and so that. So it's different. But for me, I ain't mentors. I've reached out to Kiptanui severally, to you, Yakubu was here last time, and so many other friends. But the challenge is where you now want to position yourself, like I said, as a global security leader.
As a brand.
You need to make a brand, and it's not that easy. And I was telling you this story where I went to one of the major parastatals in this country, and I was doing an interview.
Yeah.
And it was so unique because we started with the board first, and then we went to the HR. We did 2 interviews. So we started with the board of that parastatal, the executive board of that parastatal, and then we go now to the HR. And so the MD asked me, now, my friend, you look very, very lean. Like, are you sure you actually a major in the military? And it is now when I start expressing myself, when I start presenting my documents. And I know there were so many, and he was wondering, where did you get time to read all these things? And he was living in the example of other majors he has seen, the likes of Karaoke of Safaricom, the likes of, other majors he has seen. And, amejua major ni watu wakubwa,
Ni genetics.
And it was a little bit difficult at that time.
Yeah.
But like you say, you master your craft. Like Kiptanui is saying, Stanley, do the certification and make that transition be as smooth as possible. But for me, SIS Kenya was there. It's a very good organization, and watu wakatushika mkono, and here we are.
I want Stanley also, from your perspective, I know you mentioned that there are your former colleagues ambao walienda wajakata wiki mbili Kalamu. Did you face any challenge during your transition?
Yes, especially when I went to EACC. The first day I was on duty, then there's this culture shock. You are meeting your friends you were together at the National Police. They are there. The other teams of engineers, accountants, auditors, we're working together.
Yeah.
But now you can't walk around to that corporate culture. You can't go and meet your friend anytime, and you can't chat in the desk. So I found it very strange. And then when I started working, like in the National Police or the DCI, you have an investigation, everybody's asking update. Hey, you get a call from the headquarters, from the regional office, from your boss, asking how is the investigation going. Some would give you advice, and then when you're now at EACC, you find that you are working alone. Every file is confidential. You don't share information. Somebody's fearing to advise you because it will be seen that you are influencing. So you find that that culture is very different. You are doing same work, but under different environment. And then later on now, you also find that the leadership is very different. Here you have Justice Ringera, other judges, lawyers, people who have not done people without any security background before, like the National Police Service, working with you, and you're advising them.
You're the trusted advisor now.
Yes, you're advising them, but they're your bosses. So you get that culture shock. The other shock I got was when I was at Ketraco. You see, as an investigator, now maybe you arrive there, you find there are a lot of things that are not going well. And then you start complaining that maybe here we are losing money, here we're losing money. Then somebody will ask you, are you an external investigator or internal?
What are you interested in?
What are your interests? Why are you complaining? Then you have to explain that I'm here to complain because that's the job I've been employed. Kasi yangu ni complain when there are losses or when there are security lapses. So that has been the issue, that there's culture shock. Sometimes your inabilities, you find that there are some areas that you need to improve. A relationship with people. They're out there, the law enforcement, you were the law. You could arrest somebody and then start the investigation. You could prosecute. At that time, we had even prosecution powers. You just draft the charge sheet and you just take this person to court and then you investigate backwards. Now here you are told you can't touch this person, but he has to give you the documents. And he refuses to give you the documents. What are you going to do? And you no longer have the investigation, the arrest powers. Same even in corporate world. You might find that the networks of corruption or let's say fraud touches to the top, but you still have to investigate. This person maybe is a relative of the man MD, but you have to deal with it. So you come with innovative ways. You become very innovative so that you achieve your mission without causing a lot of conflict with many people.
And even compromising.
At the same time, remaining professional.
You've brought a very critical point, and I think probably before I can preempt, how do you deal with bias during investigations? Because most of the times unapata, you're given a case, you need to investigate, But, if it varies, in my opinion. It varies with what you're working with. If you're working for an organization, then your interests are, for the benefit of that particular organization. How do you deal with bias, in your own opinion?
You see, one thing is that I'm a professional certified investigator, but I've not practiced investigation like you have in the military police and the way Stanley asked before. But one thing I know about good investigation is that there are these characteristics of a good investigation, and one of them is objectivity. And here is whereby an investigator is not supposed to come up with the prejudgment before. You've not even investigated the case halfway.
Yes.
But it's like you have your own finding.
Yeah.
And this is human nature. You're trying to defy human nature. And even for seasoned investigators, investigator bias is there. One, it's like you have a prejudgment. Two, you want to finish the case before. Or you may take even too long because of other interests, or maybe because of other things you are following through. But no Stanley can tell us now how do we deal with this, internal and external investigator bias.
Yeah.
Yes, I learned this when I was at the DCI. You could get the complaint from the complainant or any informer, and then you proceed to investigate. At ESCC, and later, this is something I've adopted well, is you have to set your objectives in advance. So this is the objective of this investigation. This is the scope, because the other thing would be scope creep. The other issue, you need to declare conflict immediately when you see it involves people
Yeah.
It's something that can affect your judgment. The other thing you would want to do to eliminate bias in your investigation is you also identify your witnesses in advance, the documents you need, so that it's not guided by, you need to review at every stage, you monitor whether you are still on course. Otherwise you might be, you might prejudge and think that these are the suspects. This is the person who is killed. And I've seen this before, whereby you suspected somebody, maybe you are given information, and it happens I saw it in anti-corruption and even in the corporate world, whereby somebody wants to implicate somebody so that he steps aside and they take over office.
Yeah.
So we found most of the complainants being the deputies to the CEOs, the deputies to the governors, and you have seen that, the deputies to many other executives, whereby because of the idea of stepping aside, they can take over the position. So if you go with the complaint the way it comes, and you go and arrest somebody or you implicate somebody without having that objectivity, it will so much affect your...
The outcome of the investigation.
Judgment.
And we've been guided by the investigation standards for ASIS, for the one we used when doing our PCI, CCP. Yeah. So you need to read widely and just make sure that you are not being misused as an investigator. Even at the corporate world, people want to get rid of an employee. Then they say, can you investigate? Major Kala, can you investigate and give us a report that we can use to fire this person? Yes.
So it's already directed what you should do from the onset.
Yeah.
And I know maybe Kingsley, what makes a good investigation? Once you're doing investigation, when can we say this was a good investigation? No.
In my own opinion, when the investigation meets the scope that was supposed to be covered.
Okay.
Sometimes as an investigator, you end up being swayed so much into, as Stanley rightfully put it, into matters that don't really add to the flesh of that case. Yes. When you're building a case, you need to be very loyal to the scope. What are what do you require from this case? how are you going to select your witnesses? Looking at the chain of custody. Right now, when people present their cases, you find that some people, with digital footprints and things like that, somebody can record something with the phone and, presents it as evidence. Yes. But do they know how, if at all it's admissible or it's not admissible in court? So basically understanding the scope and understanding the nature of the threshold of evidence that you require to make a case stand in court or stand trial, that is a win for investigations, because it's not about placing blame. It's about unearthing the facts of the issue. Yes. And I feel probably that can be a very perfect segue, in fact, to ask Stanley about now the elephant in the room called the healthcare security. Yes. Because I've really had interest in understanding how security in the sphere of health, how yes. does it work, and what are the things that we need to know.
Sure. I actually know there's something called healthcare security, like a segment on its own, like healthcare security.
Yes, there are many things. In fact, you remember when we were discussing, I was talking to you, Stanley, when I was saying yes. about, I love sports. And I just saw that there's a huge gap when it comes to managing security for different areas. And that's why, when I actually learned it from you about healthcare security being on its own. And as much as things can be similar, but they're not necessarily the same.
Sure. When I left the bank to be the chief security officer at Nairobi Hospital, yeah. I just had a bias, the way we say it, on what security is about. So the first day I was around looking at how to reduce the number of entrances in the hospital. I said, these people are opening, terrorists can come in. Then I said, we have to do this. Then I spoke with the then HR manager. He told me, no, take time and understand this system. We are giving you an off, not like from active duty, but you will be around, but understanding the systems in healthcare.
Basically, the culture around
the culture around healthcare security. Then really, after 30 days, 90 days, I now learned that this healthcare security is very different and unique. Because one, the area where you're looking at, apart from the physical security itself, you are looking at more of emergency preparedness.
Okay.
You are looking at health and safety. You're looking at the visitor management is more, because it's like more of an hospitality industry, and you need to have more people coming in, and they are coming in more comfortably. So like in my first days, I said, let me set up a parking system for the facility and people to pay. Then people were asking, this system would impede accessibility to the hospital. So I also learned that in an hospital setting, parking is very key.
Yeah.
It's very key because you have, and it takes most of your time, because I spend a lot of time sorting complaints from doctors. There's this doctor who has designated parking, but even doesn't come, but it's written. So I had to do like an electronic system whereby we reserve around 20 parkings for doctors, but they just come in and access without even touching anything, whereby we have RFID system.
Okay.
Yeah, and I remember one doctor, the late Professor Makoa, he came to my office and asked me, my name is in all the hospitals. If you go to Aga Khan, you go to the Ministry of Education, you go to the University of Nairobi, you go to Kenyatta, why are you removing it here?
Now it becomes an issue.
Then I told him, Professor, we're going to make a very good solution for you. Then after that, we did canopies. And then they could just access, they don't need anything so long as the car is registered. Then I asked him later on, has it worked? He told me it's worked, but it might not work forever. I don't need it to work forever. So I found out that parking management system, visitor management, vehicle management, transport management is very important in healthcare security.
And now when we are still there in those factors,
Yes.
We are talking about a patient who comes in.
Yes.
I give my records, my
Yes.
name, what I'm suffering from, my medical history and all that. So how do we balance to protect this data from the patient? At the same time, ensure that we keep it confident for this data, for these patients. Because look at this way, Kingsley and Kiptanui. I'm suffering from something, and I'm only supposed to tell the doctor, right?
Yeah.
But they are clerks, they are nurses. There's everyone who can, access this information. How do we ensure that we protect this data from the patients?
Yes, I think it's a big challenge. Currently, I work for AIDS Healthcare Foundation, where we deal with AIDS patients throughout Africa. I'm the security manager for Africa region. And that's a major issue. Security of patients' data. And also, even bringing comfort to the patients themselves, especially if you disclose their status and then they know that somebody else will know that they are suffering from this. So what we are doing is more of training and awareness of staff. We have put security measures, physical security measures, and even encryption in the system. Some countries have even said they don't want electronic data for their patients, especially.
Because it can be accessed by anyone.
Yeah, it can be accessed
hackers all
outside the
over.
country.
Yeah.
Yes.
They are worried of transboundary because electronic data can go anywhere in the world. Yes. And it can also have some political implications on the number of people suffering from particular types of diseases. So we are doing more of awareness. When at an hospital setting, like locally here, we'd want to have like even screening, vetting of people who are working on patients' data.
Background checks and everything.
Background checks. But we also rely on now the data protection rules that have come up, the laws.
Yeah.
Yeah, that's what we're doing. But it's a major challenge in healthcare, especially if they require them for political reasons. We also do coding of this data when we have, like, even the records. If it is very serious, we might not even use the name of the patient. We use a code name
Okay.
that only a few people know, just to make sure that people don't access. But we also make it punitive if you are found to be
culprit of the same.
Disclosing
people's data. The other problem we have is the issue of now remote access. Because of remote working, people are going home and they can be able to access that data.
Yeah.
They can be able to manipulate sometimes. If we don't, as investigators, we are looking at a trail. Like the way we had in banking sector, whereby if somebody accesses data for a particular person, it leaves a trail or even sends an alert to the supervisor to say, Stanley is accessing data of President so-and-so of a particular country. And then you can be tasked to explain why you are doing that. So those are the systems that we are putting in place in healthcare globally, just to make sure that people are confident that the data they have given us is very safe and secure.
It's very critical, actually. You know, I call it personal identifiable information.
Yes.
Yeah, it's very critical, and the measures that you mentioned actually really resonate well, especially in the context of Africa and globally, as you rightfully put it. I want to introduce a topic that is in every sphere of any career, and that is diversity and inclusion. We've talked about protection of this data, protection of people's confidentiality in terms of information that they give. I think it's a perfect segue for us also to discuss a matter of diversity and inclusion. In the security space, I don't know if you've seen this, Major, in security is being seen as a male-dominated industry. In your opinion, how do you feel about it, about diversity and inclusion? So talking about now the men being more in security, and also looking at persons with disability and things like that. What's your take, especially now from the perspective of ASIS and how you view it?
Diversity is where we have access to a door. Okay. But inclusion is where there are several pathways for each of us. So having the access to the door is not the problem. But we need to be included in these pathways, in these spaces. And organizations stand to gain a lot when there's diversity, equity, and inclusion in terms of race, in terms of gender, in terms of generational gaps, and every other generation is included in that.
Yeah.
And like you've said, in terms of SIS, what SIS does to ensure diversity, equity, and inclusion is that now we have, for example, in the Kenyan context, we have the major chapter, which is the SIS Kenya. Right? This is the parent organization.
Yeah.
But within the parent organization, we have SIS Women in Security Kenya.
Women in security.
All right. So SIS Women in Security now caters for the women security professionals. All right. Okay. Then we have SIS Next Gen Kenya. This is
for Gen Zs.
Yes, for Gen Zs now. And the point here is to include them in this conversation, right? The way from, let's say they are taking the security courses, in security management and other related, cyber security, forensics, and all that. They're included in this program, or rather in being part of the profession from the word go.
Yeah.
So SIS has been very categorical in ensuring this diversity, equity, and inclusion. You'll go to an organization and you'll find the CEO is a man, head of organization, head of departments, from operations manager, procurement, finance, marketing. It's only marketing you'll find maybe there's a
ladies, yeah.
But
this balance, they are very good in marketing.
Yes, they're very good in marketing. So this balance needs to be there. And we must be, we are lucky right now. We have women CEOs for security businesses. Like we have many of them, like the likes of Victoria Mula and Adija Zama, who is the vice chair, SIS Kenya, running, background and screening checks company. And they are very, they have done well. They're actually award-winning companies. So for me, it's very key, and that's how we have done it at SIS.
I think probably the same question now to you, and it's more of just your views on in your workspace. How do you put in inclusivity and diversity?
Okay, like where I work now, this is the first time I worked. I joined an organization without undergoing those medical tests,
Yes.
whereby you just given your letter and told, can you start your job? Yes. I was surprised when I was when I was joining the police. There is always medical, joining and corruption, very serious medical everywhere. Sometimes even you do 3 or 2, 4. But now here, we are making sure that everything is inclusive. Diversity. Most of our workers, security team, we are from Africa. We don't have people from outside Africa. We also focus on people like LGBTQ, people with a diverse sexual orientation. We just make sure that they're included in all our security plans. We make sure that whenever we have like the security focus, as we do our security, we make sure we factor women, we factor people with special disabilities, and make sure that even pregnant women can be employed in security.
Yeah.
Which has not been the case here, especially in Kenya. I've seen other countries, even in the military forces or even the police forces, like even you go to Uganda, they have removed things to do with height, which was teeth.
How does teeth help?
Yes. So,
Kutafuna adui.
yeah, and then we're also removing this discrimination of making that you have to maybe worked on in the military forces.
Yes.
We are now getting new generation who have, right from the university, they are doing criminology. They are focused on corporate security. We want to bring them on board more than the military bias or the police bias, and saying that you have to have worked. We are building careers for our teams. We make sure we are training. Our policies and procedures should factor on diversity, inclusion. Yeah, just to make sure that whatever we're doing, we have that in mind.
In my view, and I've done some few consultancies for some corporates, and one of the things that I look into in terms of diversity and inclusion with respect to the persons with disability, there are things that we do normally, like you're healthy, everything is okay, you don't have any physical disability. One of the recommendations was, accessibility for them. Be it the parking, be it the ramps, even the washroom area. Those are critical things actually security personnel need to look into. And I've seen that actually work and even change the nature of how people feel included. But there's this one aspect, I don't know in your opinion, Major, what you can talk about it, when we're looking at inclusivity in terms of policy making, policies that resonate with the industry, but at the same time, actually the industry or the company that you're working for, but at the same time, firm in terms of security. This is with respect to now when talking about the Gen Zs, how you handle them. Many people say that this new generation is, is hard to work with, because they are independent-minded. How do you feel we can do it as security? Because people view security as very rigid. Yeah, when you talk about diversity inclusion, you only talk about people with the physical disabilities, but there's this crop of people who are coming up, and they are the future. How do you think we can go about that?
The few times I've interacted with Gen Zs, I want to tell you that they come from a different planet. they are independent thinkers, and it's a good thing for me. I love independent thinkers. Now let's go to policy making. Policies are made to be used by everyone. They are all inclusive. Right? That's why they are good organizational policies. They guide. What needs to be done and what not to be done, and so on and so forth. And therefore, with changing times, if they are not part of the conversation in terms of policy making, it means that they have been left out. So it is paramount to have them as part of the conversation. Right? It's like what we call public participation. At organizational level, we can have that, where every other person contributes something to the overall policies of the company. And then by the end of the day, now we ensure that everyone is included. Because you'll find that even in terms of marketing, nowadays you'll see now there's a Gen Z way of doing marketing, even with corporates. All right, because they're the one heading those departments. And some directors have been very keen to allow them to do marketing in that way, because that's what resonates with the public at the moment. Okay. And therefore, in terms of making policies, everyone need to be included in that conversation. That's when we can say no. We have a proper inclusion and a proper equity and proper diversity in the organization.
I don't know if that also resonates with you, Stanley. Do you have Gen Zs in the organization?
Not now, but when I was in the banking sector, I realized that for you to take care of security, most of the workforce are those tellers, and they're in that generation. Even in hospital, most of the nurses are that generation, and they have unique security challenges. So mostly it's technological, to do with social media. So for you to penetrate, you have to have such people on your team. And we used to have them as, like in the banking sector, as analysts. They can analyze social media, they can analyze transaction, they can, and they're very good when we're doing investigations or doing security controls. They're also very good in getting intelligence from the criminals at that level, the young criminals, especially those who are maybe doing SIM card swaps, mobile banking frauds, and whatever. So if you have people from that generation, if they're included in your team, then you can succeed more than if we ourselves, this generation, we still want to control everything. So, yeah, for technological crimes,
Very good.
They're the go-to people.
Yeah, training then again, to train that generation by somebody of that generation, it will resonate very well, and they will get the ideas on what, even the language you use in training, so that it's like you are not commanding.
Yeah.
You are not commanding them. You are not like they are from their home and then the father is shouting.
Yeah.
Then they reach the office again. The
The
same fika, like the father is also
Shouting
there as the
at them.
boss, and shouting again. So they mistrust. And I saw this even in healthcare, like away from security, like the pediatricians. Most of the youths now, they don't want to be handled by the old doctors. Because they just feel that this is like my father, my grandfather. So the young generation doctors are able to resonate with the young generation patients.
The one that can tell you that your life is not given.
Yes,
They tell you directly to your
It's not
face.
given.
yes. Yeah, so that's one area that I see we can, as security professionals, we need to exploit so much. And then we can also have transition. So that as we leave the security field, we have people we have mentored from the other generations
Yes,
to take over.
mentorship with the next gen, very important.
Yes. Yeah.
Good. Now, you've mentioned that you are the Africa Security Manager for AIDS Healthcare Foundation, and I want us to move to this conversation within the healthcare security, but now in terms of emergency planning and response.
Yes.
And I understand that you're actually a member of Institute of Strategic Risk Management. I know you have a level 6 diploma in strategic risk. And I know you're also a master's student at the National Defense University, Kenya, for crisis management and disaster response. So you're actually a subject matter expert in that. So in your line of work and within healthcare security, what makes a good emergency plan? What makes, when can I say that we have a proper plan for disaster response?
Yes. In healthcare, we will have two levels. Like at the hospital level, we have to have that plan, emergency plan. But there we are looking at maybe things like fire, maybe spillage, hazardous spill. Maybe we are looking at, it's mainly fire, hazardous spill, and maybe active shooters, terrorist attack. That's what we're looking at the hospital setting. But so we need to have a plan on preparedness, trainings, simulations.
Very important.
Yes, when I went to when I became an hospital security manager, people used to fear evacuations. They say patients would be, they might be injured, this might happen. But I was able to work with Red Cross and set up a training plan, and then now do a multi-agency. All the hospitals and the neighbors a call together, and then you plan a drill.
Yeah.
Patients are made aware in advance that there will be a drill. Then you have to have support on the budget to have the gear, like the reflectors, the radios. You have a good communication plan for your emergency. That's at hospital level. You have to have a good redundant communication, maybe a radio system, and then a telephone system. And then we used to make sure that there is an hospital incident command system. HICS, we call it HICS. Just like the military incident command system, but here we are more of having trained incident commanders. So the plan should come out very clearly. And then the other plan that combines both the NGO, humanitarian sector dealing with healthcare, and also the hospital, is a contingency plan. When there is an anticipated disaster. And I've been working this well even with the other colleagues in the industry, whereby we have a good contingency plan, and we are working mainly on elections. Like currently the recent South African election. We make sure that we have in place a plan for the country team. And that plan should have the action points, who is in charge, and then it should have a call tree with alternative persons to support if the main actors are not there. You should have communication redundancy. We've been working on satellite phones, even those areas where we have natural disasters, like floods. Malawi, Mozambique, here in Kenya, and even in Nigeria. We just make sure that we have plans in place. So we encourage our people to have stocks, hibernation stocks in their offices, and also in their homes. I saw this when we had the floods in South Africa. All the communication systems were damaged. We couldn't reach the shops. So we encourage them to have stocks for 7 days. And then another major thing that we need to have as emergency preparedness is training. You make sure people are trained on those plans, and we do it regularly. But even before the emergency or prior to maybe an election, we need to have even to train even the logistics people. We have to have funds in place. We've seen mostly some emergencies would not even allow you to go to the bank. But now you might also not hold cash in the office, because that office you might not be able to access. Like the other day in Sierra Leone, for example, we had a mutiny. Then I talked with my colleague there, the country program manager. We have satellite phones. Then he told me, I'm at home. Then I said, do you have the contingency phone? He says, yes. So those are people who are well trained and they're ready to face such emergencies.
I think that's it really brings it out clearly, and I wouldn't want us to wind this up without talking about what is our common denominator, which is ASIS, what it has done to us, and probably Major, you can tell us more about this upcoming event that I wouldn't want anyone to miss. Any person who is in security has to be there. Tell us more about it.
We call it SASCON, the Sub-Saharan Africa Security Conference. And this is a conference for the whole of Sub-Saharan Africa. And it will be happening right here in Kenya at the Edge Convention Center. This is now at South Sea. That's from 24th of July to 26th of July. And we have security professionals all over the world, from the SIS International coming to be part of this conversation. The theme is actually building a smarter and safer Africa. Building a smarter and safer Africa. And so it's just a call for every other security professionals to attend. And I know Stanley is actually triple certified.
It's triple certified. We all look up to it.
It's among the few 200 security professionals in the whole world. You know, they are slightly less than 200 in the whole world, and Stanley is part of that. So maybe Stanley can tell us what these conferences mean, where they are important. I'm sure he's also a very good attendee of the Global Security Exchange, United States. He's been going there. He was there last year, the year before. So maybe Sandy, you can tell us why are these security conferences important?
Yes, I recall when I used to work in the Nairobi hospital and even in the bank. That time I was at NCBA. I used to wonder where to get this technology. My CEO would say, can you look for a technology for visitor management, a technology for like barriers, for example. Then I found that my knowledge was so limited. So one time I went for a security expo. I think it was somewhere in Westlands. Then I was shocked that whatever I've been looking for, everything is here. From the radio system, from the visitor management, and then all the people I was looking for to network. Like, I'm a member of the International Association of Healthcare Security Professionals, and also a member of ACES. So I got an opportunity to go to the GSX, which was in Atlanta. And I was surprised, everybody we used to, like the people who have written a lot of research in healthcare security or physical security, we were able to meet and talk and discuss many issues. And it elevated my confidence. Yes, and I just now would be able to call these people when there is a need to understand something. Yes. The other thing that would be very much important for such conferences that we will have some presentations, some talks. You'll be able to get to ask questions, and you'll be able to expand your knowledge so much. Yes. So I encourage even all professionals, all security professionals in Africa to attend this conference. To attend this conference. And more so, not the top professionals only, but even the young professionals in security, students, people who are starting their careers, and not only security professionals, even CEOs, operations managers, people who are supporting or regularly working with security teams can be able to attend there. Procurement managers, they can be able to see what is being displayed, the technology. They'll find all the technology they've been looking for.
Yes, because just to add on it, apart from the theme which is now building the smart and safe Africa, there are various sub-themes. You know, we're talking about political instability, terrorism, security solutions. So there are a lot of sub-themes within the main theme, and we'll have breakout rooms. So you can always go to the room which you want. And not Stanley, because we're talking about certifications, and you mentioned something I don't want it to escape us. You said you are a member of the International Association of Healthcare Safety and Security.
Yes.
There's a specific certification in healthcare security. And honestly, it's only you I know who have it. I never knew it actually existed. You can tell us maybe about that healthcare security certification that now viewers and the crew for the whole team watching this Crimeshield podcast can understand about healthcare security certification.
Yes, so just to add on what you've said, Major Kala, when I joined the healthcare security, as Kingsley had said in the beginning, it was very unique. Then I started looking for ways to make myself an authority in this field. There are a lot of certifications that the hospital itself, the healthcare facility, requires. And one is called Joint Commission International. And one of the requirements, the security manager should be well-versed and should be certified. So from there I learned that the recommended security manager for an healthcare facility should have a certified protection professional from ACES and also certified protection administrator from IHSS. So I said I need to do these 2 certifications. They are similar a bit when it comes to technology, access control, but here you do more of emergency preparedness in certified healthcare protection administrator. You also do a lot of safety because mostly in hospitals you look at more of safety. Patients, maybe hazardous spillage. You look at those issues, root fire. So you do that. And then another unique thing is managing healthcare security workforce. It's one of the aspects. And apart from, because I'm a member of IHSS, apart from the certification at the certified healthcare protection administrator level, we have more online courses on just security officer enhancement. So even the security guards working in hospitals, they can still do a certification online, but not at the level of administrator level. So this healthcare certified healthcare protection administrator is a unique credential for healthcare security staff. And we are 2 now. I know Robert Tak at Aga Khan has been having it even before me, but at the US level. And then myself. And I've also been receiving calls for mentorship from even healthcare security professionals in Indonesia, in India, in Singapore. And I've been supporting them, even in the US and Canada.
Wow.
They have also been coming to me online and say, Stanley, can you tell us what can we do? So I encourage our own healthcare security professionals here. Yeah, because I remember when I joined healthcare security, the turnover was very high. You could hear that a security manager comes to this hospital, more than 6 months is gone. But when I joined them, then I brought them together. We have our own WhatsApp group. We discuss a lot of issues and we do a lot of mentorship. And then the turnover is not now the way it is. You'll find people have served now 6 years, 7 years. And also, it encourages you to be in the same language with the doctors and healthcare workers because you learn a lot, especially on workplace violence.
Yes.
I remember the first day I met a team of doctors. And they say, can you train us on workplace violence? Then I was like, where do I start? Design of facilities.
Yes.
You know, as an hospital, it has unique design of an hospital facility. It comes with like SIPTED.
Yes.
Yeah.
SIPTED is a crime prevention through
environmental design.
Yeah, so where do you design the pharmacy? How do you make sure? Because now these are facilities that you cannot restrict.
Yes.
How do you make sure that the pharmacy is accessible, but still there are some security controls?
Yeah.
Where do you put your emergency department? Because we deal with mental patients. If you put seats or that are not fixed, for example,
Yeah.
when a patient is upset,
You can
pick use it
up
as a missile.
weapon, yeah.
That I learned when I put fire extinguishers
Yes.
at the emergency room. Then my team told me, you have to put a box and make sure it's sealed. I said, no, but the safety requirement is that it's not sealed. Then they told me the mental patients will just pick this one and they use it as a missile to attack the healthcare workers. So those are the unique things that you need to learn.
Yes.
So with that certification, they will give you the industry design guidelines for the facilities. So when you are designing like an outpatient branch for your hospital, you don't need to labor because you will just go and pick the standard, go through
Implement
it. So the hospital design that we are doing here in Kenya will be the same which is being done in Canada, done in the US, in the UK. Yeah.
So the standards and guidelines will be the best practice for the industry.
Yes.
And you've mentioned something about, workplace violence. That just reminded me something as we wind up about mental awareness. Kazi ya security ni ngumu sana.
Mental health. Yeah.
It's very important. So maybe we'll start with you, Kingsley. How can we ensure we are sane? There's mental awareness in our organizations. People work for us and everything. So how can we ensure mental awareness in our organization?
I think the first thing we talked about is being aware of what you can be able to achieve and accomplish as a security professional. Learning the language of the place where you are working or the place where you're serving is very key, because now you don't get to be at loggerheads with people. That is the first step that you can take, by first understanding yourself, understanding the area that you're working in, the language that is there, and also being able to be empathetic, being able to understand what other people are feeling, and then you put yourself in their shoes. So overall, I'd say that it's very critical for you as the person to take charge of your mental health, because you understand yourself better than anyone else. No doctor can understand you better than yourself. So at the end of the day, as a security professional, in my own opinion, it's important for you to understand yourself, the space that you're in, and also understanding the language of that environment that you're in.
Okay.
Yeah.
So maybe Stanley, how do you ensure mental awareness at the Healthcare Foundation?
Yeah, mostly we do like support. Lucky enough, our organization deals with already, because we deal with HIV/AIDS, we have a lot of counselors in-house. So who are doing counseling. So sometimes we use them, but we also rely on the people doing like our medical cover. They have some solutions, some counselors that you can approach, and then they can support you. But more so is to make sure that the work environment is so good that we can be able to detect people having mental health challenges, give people break, work-life balance. So the advantage we have also is sometimes we also do like remote working. You work from home, you spend more time.
Very important.
Yeah, and take some rest break. And then trainings. Yeah, we've been having like, especially our medical healthcare, medical cover. What do we call it? The people providing us with medical
Insurance companies.
Insurance companies, yeah. They also have some trainings and awareness. Okay. So they do regular mental awareness training. Yeah, so that's what we do.
I think Major, you can give us your parting shot, because we haven't even touched the top of whatever we are talking about, because we've brought in the issues of insurance. But I know this is a conversation we'll still hold, and just to bring clarity, what would be your parting shot from this discussion that we've had?
Security is wide, and like you always say, there's something for everyone.
Yeah.
Peter Kala is not going to do background checks and screening. I'm not going to be a subject matter expert in investigation. I'm not going to do cybersecurity. Master, you are, be a master of all, but know your craft. Like I said, you are not being a job seeker. You are positioning yourself as a global security leader. And it's the same way Stanley is trying to explain, for healthcare security, do this certification.
Yeah.
So you see now that it's tailor-made for healthcare security.
Healthcare, yeah.
So when it comes to you talk about event security, this is what is tailor-made for event security.
Yeah.
When you're talking about consultancies, like what I'm doing currently, this is what is tailor-made for that. So understand your area very well. be good at it. I say the goal is not to compare me and you or me and Stanley, but the goal is to be the better version of yourself. Be a better security professional every day.
What about you, Stanley, as you wind up?
Yes. So for me, I would encourage people, security professionals, to keep learning. You learn a lot, and you will be able to position yourself globally, the way Major Kala said. Let's not look at here in Kenya, like competing local here. There are a lot of international opportunities for security professionals globally. Remote jobs that you can be able just to do from here in Kenya, but covering the whole world. You don't need to travel. You don't need to, or you travel rarely, but you'll still be competing with other security professionals globally. So let's keep learning. Let's do the certifications. Let's keep also networking, like attending conferences, the way we've said. And also let us mentor our colleagues.
Yeah.
Don't feel like this person will compete with me in the field, but it will complement. Because what I've seen in most international organizations, when they employ a security professional in Nairobi, and then they get a very good security professional from Kenya, for example, based here in Nairobi, they will tell another organization, we've gotten a very nice security professional in Nairobi. Then that organization also will look for another security professional in Nairobi again. So we end up getting more opportunities if we are able to express our professionalism as security professionals here in Kenya. Because more organizations will say, I don't want to have a security professional in Kampala. I don't want to have in Nigeria. I want to have in Nairobi, because all other organizations are having security managers based in Nairobi, Kenya. So let's build our country. Let's build our reputation as security professionals here in Kenya, and more opportunities will come for us.
Amazing, amazing, amazing. As always, we always tell you that what I've picked from this conversation is why be ordinary when you can be extraordinary. So for me, to the viewers out there, as always, there's something for everyone in this podcast. And as always, we talk about pertinent issues that affect you on a daily. We talk about issues that affect you every single day. We've talked about healthcare security. We've talked about your opportunities that are presented commensurate to what you've studied in security. Here at Crimeshield, we say that see you next time, and keep it Crimeshield.
Thank you. Thank you so much.